Hundreds of thousands of students will return to class this fall without access to their devices as states try to crack down on cell phone use.
It comes as a new study warns of a potential link between heart health and excessive screen time. Fox News correspondent Alexandria Hoff tells us more.
As the school year gets underway, public health officials are sounding the alarm on excessive screen time. A study published Wednesday in the Journal of the American Heart Association found children and young adults who spent more time on their devices may have a higher risk for certain heart issues, including high blood pressure and high cholesterol. Researchers say the link was strongest in people who slept fewer hours, suggesting increased screen use can steal time from sleep.
Smartphones and social media affect the mental health of children. It can become highly addictive.
More than half of states now have laws in place restricting the use of cell phones and other electronics in the classroom. New York set aside $13.5 million in its budget to help store student devices.
The kids are just staring into their hand the entire class time, not absorbing a lot, becoming more anxious and withdrawn.
According to recent research by Pew, 74% of adults say they support banning cell phones during class. That's up from 68% last fall. And leaders on both sides of the aisle say the legislation is already making a difference.
The kids are talking to each other at lunch. We know that test scores will go up, and so academic performance, because there's more focus in the classroom.
Those who oppose the ban cited physical safety as their top reason, though some experts say phones can actually distract students in an emergency. In Washington, Alexandria Hoff, Fox News.
Department of Health and Human Services will cut $500 million in funding for vaccines. HHS Secretary Robert Kennedy Jr. announced the funding was for vaccine research and development. Most of the cuts for vaccines for COVID-19 and the flu. But Kennedy says the government is moving away from the mRNA technology used to create those shots.
Now we're developing a universal vaccine at NIH, which is a vaccine that addresses the entire phylum of viruses.
Kennedy points to research linking mRNA vaccines to heart issues in young men and says they aren't effective against diseases like COVID. But many doctors say those claims aren't true, and future pandemics will be harder to stop without the help of mRNA.